Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikulu. First, the highlights. While the battle is on to ward off a third wave of COVID-19, another battle is being fought by Nigerian workers against the downsizing of the workforce in Kaduna with a protest march on the streets of the state. And Yobe State commences construction of model school blocks to solve the current congestion in classrooms and prevent the spread of COVID-19. And South Africa commences the second phase of the COVID-19 vaccine rollout, targeting people over 60 years old. Well, COVID-19 may have come with its negative impact on livelihoods, but the Nigeria Labour Congress is fighting back what it believes is an unfair disengagement of civil servants at the state and local government in Kaduna. Well, it's mixed adherence to the wearing of face masks and social distancing at the protest march earlier today. Clearly, for these workers, livelihood comes first. They are joined by affiliate members from the National Union of Petroleum Employees of Nigeria, National Union of Electricity Employees of Nigeria, NUI, National Union of Textile, Tailoring and Garment Workers of Nigeria. The national president of the NLC, Mr. Ayuba Waba, insists that the state government has no legal right to sack workers without following laid-down labor rules. Meanwhile, the state government says it is not backing down on its redundancy exercise, but it is ready to negotiate with the leadership of the labor unions to find a way forward. Well, it's World Hypertension Day. The WHO says an estimated 1.13 billion people are battling high blood pressure globally, and they're more likely to get severely ill from COVID-19. We'll be bringing you more insight on just how to manage that in the context of COVID-19 in a moment. But first, a look at the latest COVID-19 trends. In the last 24 hours, Nigeria recorded single-digit daily cases for the first time in over a year, and no fatality. Now, while that might be cheering news, the NCDC is asking Nigerians to maintain a high index of suspicion for COVID-19 and adhere to all preventive measures.
The rate of COVID-19 infections in Nigeria has remained relatively low, with a record of 7 new COVID-19 infections, according to the latest update by the Nigeria Center for Disease Control, the lowest single-day count so far in 2021. The new figure is a drop from the 41 infections recorded in the previous 24-hour cycle. 5 of the new cases were reported in Niger State and 2 in River State. The overall count of confirmed cases in Nigeria now stands at 165,709. According to the agency, no new death was recorded from the virus, leaving the fatality toll at 2,066. One person has been discharged in the last 24 hours after testing negative to the virus, increasing the total number of recoveries to 156,413. Meanwhile, Nasarawa, Lagos, and Ondo states account for the states with the highest number of cases still on admission. Currently, there are over 7,000 active cases, while more than 2 million samples have been tested so far. Over 1.8 million eligible Nigerians, representing 90%, have been vaccinated with the first dose of Oxford AstraZeneca vaccine so far. In an update by the National Primary Healthcare Development Agency, Cross River, Ekiti, Kwara, and Lagos states, the FCT have vaccinated more than 50% of its eligible population required for the first dose. Across several countries in the world, more than 163 million confirmed cases and over 3.3 million deaths have been reported so far.
Let's head over to Yobe State, where the government is creating safer spaces for students to learn as it commences the construction of classroom blocks across the major cities of the state. The classrooms are designed to give more space for social distancing and other measures outlined by the Nigeria Center for Disease Control. Currently, one primary school in Potiskum, which is a commercial center of the state, has a population of over 18,000 pupils, making learning and adherence to safety protocols very difficult.
Potiskum is located 100 kilometers away from Damaturu, the Yobe state capital, the most populated city in the state and one of the local governments with high records of the COVID-19 disease. This is Arikime Primary School in Potiskum, which has a student population of about 18,000 with 400 pupils per class. Worried by this development, especially during the COVID-19 pandemic, which requires social distancing among other safety measures, the state government is embarking on construction of model schools and established learning centers across the major cities to solve the challenge of overpopulation.
A classroom accommodates about 400 pupils. Under this administration, 30 learning centers have been established in Arikime to decongest these classrooms. And as it is today, from 400 pupils per classroom to 150 pupils. And it is still work in progress.
Some educationists and parents believe that the construction of the model schools will help improve the current learning situation in the state.
In Potiskum, we have a primary school called Arikime Primary School. It's one of the most populated primary schools in West Africa. But with the construction of these model schools, it has decongested the school's population, and it has also helped in observing social distancing in avoidance of the COVID-19.
And this school is supposed to have between 40 to 50 learners in a class, so that as a teacher you have the ability to go around the class to know your learners and to be able to know them with their problem. But in a situation whereby the class is overpopulated, you will not have access to go around the class. You will be at a fixed position because of the population that is in the class.
The latest figures by the NCDC shows that Yobe State has only 436 confirmed cases and 9 deaths arising from COVID-19 complications. With this new move of the construction of more classrooms by the state government, experts say a lot will be achieved in flattening the curve of coronavirus in the state.
Now, for more insight on where Nigeria is currently in the fight against COVID-19, what lies ahead, and more importantly, where we need to put in more work, well, let's speak with Dr. Abiodun Egwenu, an epidemiologist at the Nigeria Center for Disease Control, NCDC. She joins us live from Abuja studio. It's great to have you on the program, Doctor. Let's begin with the figures. Nigeria recorded 7 COVID-19 cases in the past 24 hours. Now, that's a record by all means, but how do you interpret those figures as an epidemiologist who has been, following these figures? You've seen the highs and the lows. You've seen the trend. How do you interpret this? Because for some, it's a relief, a sigh of relief that maybe the worst is over. What is it for you?
So for us at the NCDC, we see the numbers as what the states are reporting. But over time, we do know that there has been challenge with reporting and testing, mainly due to a low index of suspicion. We do know that there are over 100 laboratories in Nigeria that have the ability to conduct COVID-19 testing, and every state has at least one public or private laboratory that has the ability to conduct testing. But we do know that with human behaviors, there are several guidelines we need to adhere to, which includes testing, but several health workers and because of competing infectious diseases, people might have forgotten that COVID-19 is still here. They might think that COVID-19 has gone, but it's still here with us. And this is also a clarion call to all health workers and the public that COVID-19 is here. We need to still be aware, have a high index of suspicion, and go to the hospital or laboratory for testing if you feel any signs that are similar to those that have been prescribed for COVID-19 infection.
There was this saying at the earlier part of this fight against COVID-19 that for every case detected, there's so many more cases that are not detected. So for these 7 cases, if we could just extrapolate, just how many maybe do you think may have been undetected?
So we cannot say, but it's been found out that at least about 70% of cases go undetected, meaning that they are asymptomatic. And this is in keeping with other viral infections where people, either because of their immunity or other factors, might not raise an immune reaction. It is the immune reaction that results in the symptoms that we see. So it is possible that people have this infection, but they are able to ward it off. But we are worried about persons that do not have the capacity to either ward off the infection, or people that might develop severe disease, like people that have other diseases, comorbidities, hypertension, diabetes, or the elderly, or people that are on also immunosuppressive medication like cancer therapy. These are the groups that are high risk of severe disease or death. And these are the groups we want to protect, which is why everyone needs to protect his or herself so that he or she can protect both their families, their neighbors, their friends, and their loved ones out there.
Now, still on just accurately knowing just how much we have on our hands. I mean, looking at the figures, so far, the MPHCDA has vaccinated almost 2 million Nigerians in less than 3 months, 1.8 million actually. So if you look at the testing figures, we finally reached 2 million, just above 2 million, after about 15 months. And if you compare that, you begin to wonder, how are we achieving more vaccinations than testing rather, because for a lot of people, that's what they focus on. More vaccination in 3 months and less testing in 15 months.
So we do know that vaccination is one of the key measures for preventing COVID-19, and it's one of the strategies that has been rolled out globally. The issues with testing is not only because of the COVID-19 pandemic. It is also part of our health-seeking behavior, which is why the government over time has rolled out support for the states to improve generally the architecture of healthcare and also laboratory access. So, for testing, you have to either notice the symptoms or somebody has to be positive, and then the person will be captured on the system and the contacts traced, either one way or the other. But for vaccination, anyone can go for vaccination. And this is being led by the National Primary Healthcare Development Agency. So for anyone that has received their first dose, this is also an important time to say we must complete our doses because we are protecting others by getting vaccination. But we do know that there is a global shortage of vaccines currently, especially since the largest producer, which is India, is having challenges at the moment. So both the non-pharmaceutical interventions, wearing of face masks, hand washing, and also keeping social distancing, these are all critical parts in the response to COVID-19. All are important, especially at this time where we do know that there is still a challenge with vaccination globally and including in Nigeria.
Well, Dr. Abiodun Egwenu, an epidemiologist with the NCDC, always a pleasure speaking with you on the program.
Thank you for having me.
Well, outside Nigeria, earlier today, South Africa commenced its second phase of the COVID-19 vaccine rollout, prioritizing those over the age of 60. The Minister of Health, Dr. Zweli Mkhize, together with the Premier of Gauteng Province, visited one of the vaccine sites to oversee the process. Minister Mkhize outlined government's plans and the target for this second phase, with an assurance that the vaccines being administered are safe after the Johnson & Johnson jabs were temporarily suspended due to reports of blood clots.
This phase 2 is supposed to give us 16.5 million people that must be vaccinated. We want to push for that as much as possible. So we do know that people have been waiting for long for these vaccines. We do know that people are still wanting to get the vaccines now, but we are pleading for patience, and we are really thanking South Africans for working with us until this process kicks in at the point at which we are. We know that we would have loved to have the vaccines as early as January or December last year. It was not possible, but now it is here. Let's make use of it. Let's also work together, because what a number of people need to understand is that if we go into these phases, then there'll be no clogging of the system, there'll be no jumping of the queue. We'll clear people and deal with them as quickly as possible. Many people have been worried whether we will be able to reach the targets. I'm saying we're going for our targets. Whatever happens, we have to push. But we do know now that on the latest estimations, it's going to take us up until first part of 2022.
We'll be bringing you some of the major things you need to know about hypertension in the COVID-19 context as the world marks World Hypertension Day. But that's after this break. To join us again. You're welcome back. As the world marks the World Hypertension Day, medical experts have continued to warn those with underlying conditions such as high blood pressure, diabetes, and even cancer not to expose themselves to the COVID-19 virus. Well, this is because these category of people have a bigger challenge when being treated for coronavirus. And as a way of bringing medical care to these class of people, the Office of the Chairman of Nigerians in Diaspora Commission and some Nigerians in diaspora have set up an international cancer center and a specialist hospital. The chairman of the commission, Mrs. Abike Dabiri Erewa, says this will go a long way in cutting down on the frequent travels abroad, especially by cancer patients.
Nigerian doctors abroad, they left their comfort zone to come and set up this world-class hospital here in Nigeria. And at the time that we're saying, oh, we're going through challenges, you find Nigerians in the diaspora, particularly in the medical field, that are having faith in their country and bringing the very best of healthcare. With more of them doing this, we'll say bye-bye to medical tourism. Because with this here in Lagos, you don't need to go abroad for anything that's with cancer. Even your comprehensive medical test and a few other things, you don't need to go abroad. So with more of this should be encouraged. Government on its own part needs to support, create an enabling environment, make it easier for them to get all this equipment and machines in and all that. One of this first equipment we've seen here is one of 5 in West Africa, with Nigeria being one of that 5 that has this equipment.
Well, at the inception of the COVID-19 pandemic, health information was the in thing. In fact, so many people pretty much became overnight health experts, sharing information on what fruits and vegetables can boost the immune system, how to make herbal concoctions, and the rest. Well, all that has definitely reduced. But now, more than ever before, there is a need for increased awareness on the prevalence of some health conditions that give COVID-19 an edge in this battle. And so, in commemoration of the World Hypertension Day, we're joined by Dr. Folashade Ali. She is a consultant cardiologist. It's great to have you on the program. Well, the prevalence of hypertension is even more in this part of the world, as we account for a large chunk of the global 1.13 billion people with high blood pressure. First, do we know why we have this much burden in Africa, specifically Nigeria?
Good evening. Thank you for inviting me to this program. Today, the World Hypertension Day. It's quite a day, that we all need to key in as regard to hypertension management and all that attached to it. Hypertension is quite prevalent all over the world, but Nigeria is not excluded. It's also inclusive. There are more people in Nigeria now having high blood pressure than before, and this is likened to the fact that many things have changed over the course of years. Now everybody wants to live the Western lifestyle here in Nigeria. Everybody wants to do the white-collar job. Everybody wants to eat the best delicious taste. Lifestyles have changed. Smoking, drinking, all kinds of habits has come up. This that we don't see before, and people have more of sedentary life now. People, from the air-conditioned house, the air-conditioned car, to the air-conditioned office. Unlike in those days, whereby you do a lot of walking. So many things have changed, and so also disease pattern and hypertension is also inclusive. So we see more of this, and of course, stress, a lot of economic stress on ground, a lot of, when somebody is under stress, you can't even take care of yourself. You eat anything you like, you can't sleep well, you can't drink well, many things, and all these habits, they add on together, and if continuously stimulates the hormones, the enzymes, the sympathetic nerves, and therefore the person is chronically, under stress and chronically sympathetic stimulation, and of course, the resistance of the blood vessels increases. So all these things add on together and making the prevalence of hypertension on the rise, even Nigeria as a whole. Much more, we are now seeing hypertension even in young individuals, young adults. Before it used to be that hypertension is prevalent among the 40s, as from 40s, but now you see even undergraduates and young folks, 20s, 30s, developing high blood pressure, serious one, 140 over 100, 160 over 100, 170 over, some ridiculous figures. And so all these are hard on. And then coming on the insult of COVID-19, worsening matters. So I think we are in for a big time.
Apparently, you just nailed it right on the head, because COVID-19 just came and made a bad situation worse. Now, for some, they don't quite understand the immediacy or how close this threat is for both young, which you just mentioned, and the old. From your experience, how does hypertension or high blood pressure make COVID-19 worse?
Okay. The issue is that COVID-19 organisms attach it itself into
Oh dear, just when we're getting into the meat of the matter. But I think we have Dr. Ali back. If you can hear me, please go ahead.
COVID-19 attaches itself, onto the epithelium, into the blood vessels, stimulating inflammation, and inflammation is settled, and that is the blood vessels can no longer function effectively as they are supposed to function. And making it worse is the formation of blood clots within this vascular tube. So therefore, if you have high blood pressure before that is not controlled, or that was not detected, or that was just there, not.
Okay, so maybe we'll have this conversation, in days to come. But, you've shed a lot of light on this already. But I'd like to thank you so much, Dr. Folashade Ali, consultant cardiologist, for shedding light on World Hypertension Day and just how to make lifestyle changes such that we don't predispose ourselves to worse COVID-19 symptoms. Well, let's head outside of the country, where the daily record of COVID-19 cases dipped slightly in India today as parts of the country deal with a raging cyclone. Meanwhile, economies are reopening in other parts of the world, and citizens are being encouraged to come out and enjoy their day. Here's a global update.
While India begins battling its latest challenge with Cyclone Tauktae, it continues to face another challenge with the surge in coronavirus cases. The daily caseload dropped under 300,000 today for the first time in 26 days, according to the Health Ministry. Official data showed that India added 281,386 more coronavirus cases in the past 24 hours. The South Asian country saw 4,106 more deaths as a result of the coronavirus in the last 24 hours, bringing the death toll to 274,390. Italy registered over 5,700 new cases and 93 new deaths in the past 24 hours on Sunday, seeing the lowest daily number of coronavirus-related deaths since October 24, 2020. The country's total tally of cases now stands at over 4.16 million, with a total of over 124,000 deaths so far. South Africa has begun vaccinating people over the age of 60 as it launched the second phase of its vaccination campaign. In Cape Town, celebrated apartheid activist and cleric Desmond Tutu was among those vaccinated today. He left the hospital waving and giving a thumbs up. Along with the over 60s, the government plans to vaccinate those with comorbidities and workers deemed essential for economic activity in that second phase.
Well, it's fantastic. It's not 11.
Finally, in the UK, the Mayor of London has encouraged Brits to visit the capital as coronavirus restrictions eased today, allowing people to hug, meet people inside and travel abroad after a 4-month lockdown.
City, we've launched the biggest domestic tourism campaign London's ever seen. Let's Do London, encouraging Londoners to come back to the West End, but also those across the country who may be crestfallen and not having a holiday overseas to see and taste the best of the world here in London.
Prime Minister Boris Johnson advised people to cuddle cautiously and served notice that the spread of the coronavirus variant first identified in India meant that the final UK reopening in June could be delayed. Khan said he hoped the Indian variant would not knock the UK's lockdown roadmap off course.
Well, don't forget to protect yourself. The virus is still out there, so continue to take responsibility. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikulu.